And now to health matters. Nurses in Nigeria's capital, Abuja, have called for the declaration of a state of emergency in the health sector. This follows the recent revelation by some nurses in the country that the health sector lacks a verified and reliable database of registered nurses, thereby affecting citizens' access to health care in the country and promoting quackery. Some of the nurses took to the streets of the capital a few weeks ago, where they called for lawmakers to intervene in the issues concerning the verification of nurses mandated by the Nurses and Midwifery Council, a situation they say is affecting their performance and professional development. They say the closure of the verification portal by the council has become a source for concern and urged the federal government to compel the council to reopen the portal so that verification can continue. To discuss this now, we are joined by Alexis Isioma, a nurse from Abuja, who will be giving us more details on this development. Thank you so much for joining us, Alexis, on the news.
Thank you very much for having me. Good evening.
Okay, so I'd like to quickly find out from you, what is the impending situation as regards the lack of verification portal or a database for nurses in Nigeria? What are the attending issues and how would that affect your profession in the country?
Thank you very much for that. First of all, I would like to talk about verification. So the government and even the NMCN, they have swayed away from the actual reason why nurses are being verified to using that as a means of stopping nurses from going out to practice. That's the Jackpot syndrome. Okay. So verification generally it's also the fundamental right of every common man on the streets. Why did I say so? If the verification portal is made open for everyone to access, you'll be able to access who is giving you care within minutes. And the issues of death would be reduced to the barest minimum. Like in the case of Mohbad, if they had access to verify who was giving them care as at that time, I'm very sure that death would have been averted at that very moment.
So the portal has been closed since when?
The portal has been closed since November last year. Until now, nobody has been verified.
And that is also affecting the issue of not having a credible database for nurses. Basically, is that what it means? Okay.
Yes.
Okay, so
I think,
yeah, you were going to say something.
Yeah. One thing they don't understand about this whole verification thing is it's the rights of everyone. Okay? Nurses do not carry their license about. But if the data is made open and easy for everyone on the street, like you just log into your Facebook, you log into your WhatsApp, and you can easily chat up somebody, it should be made that easy, that you log in a nurse's name, and the database there shows, okay, this nurse is either licensed to practice or this is a quack. Then at that moment, you run for your life. But now you cannot even differentiate from who a quack is or who a registered nurse is. Then everybody is at risk. It might not have happened to anybody. Definitely it have not happened to anybody directly, but one day it will definitely happen to somebody. And maybe by then it will be very late to turn back the hands of time. And that is why we are still appealing to the House of Rep that they should help us open up the verification portal.
Okay, so we hope that it will not get to that point, to that irreparable point. But then, of course, 2 weeks ago, just as you have said, a peaceful protest walk was conducted by nurses to the National Assembly. Now, a couple of issues were raised by the nurses, including the issue around database and portal. Have those issues been addressed? Is there anything that has been done?
Okay, as we speak now, nothing has been done, but the House of Rep has put a public hearing for 28. So hopefully we are hoping that we have a good outcome on that day. And this issue is not just swept under the carpet and nurses are left to just wallow away in their pains.
So if a state of emergency is declared on the health sector, what do you think that will solve? What are the chronic fundamental challenges that you think that might actually address?
Okay, so if a state of emergency is raised, I think the people in the public will also raise an alarm and let it not just be the nurses shouting about it. That everybody living on the street, we know that, okay, their life is at risk, and they will help also raise a voice so that this issue will be addressed on time.
Before I let you go, Isioma, I'd like to quickly find out, because you talked about the Japa syndrome at that particular time. Do you think it is nice? Because, of course, we have brain drain in the country, and we understand what the situation is in the country as regards remuneration and welfare and a working condition, a good working condition for medical practitioners. But do you think it is wise and nice for medical practitioners like you to leave the country knowing that the country is faced with a whole lot of challenges, a lot of people are sick, and of course there's a need to tackle that, and we don't have enough practitioners or medical personnel to attend to the number of patients or people who are sick in the country?
Yeah, the question should be that, are the healthcare professionals or the nurses that are being trained, are they duly employed? That should be the question. We have so many employed nurses, and yet the few that are employed cry out for brain drain. There is no shortage of nurses. Rather, they are not employing nurses. If you go to private hospitals, you see most of them, they use their nurses, the auxiliaries they train and call them nurses, and putting the life of the common man, the public, at stake. Because most of these high and mighty, they don't utilize these hospitals. That is why we want the public to know that it is their right, not just because the nurses are crying out for this whole verification, it is also their right to verify who is giving them care. So the Japa syndrome, if they really want to curb that, they should ask these people, what do they want? Is there a good environment for them to practice? Are they being well remunerated? Are they even being well recognized? That should be the question.
Okay, Alexis Isioma, thank you so much for sharing your thoughts with us.
Thank you very much.
All right.